This week, the aftermath. But first, I'm Quinn Emmett, and this is Important, Not Important. It's science for people who give a shit. You can hit subscribe right now in your audio podcast player or your YouTube player or whatever to get this essay and my conversations with the world's smartest people every single week. There's almost 200 of them in the back catalog. You can find the email or web version of this and links to everything at importantnotimportant.com or right in your show notes. And now for today's big question. What comes next? That's a question I get pretty often, and not just from my children, who are insatiable monsters. The only answer to what comes next is generally, I have no idea. But that doesn't exactly pay the bills around here, so I'm constantly going through a pretty messy process where I smash together all of a situation's known knowns, known unknowns, and paradoxically, unknown unknowns. 2, any potential stakeholders. 3, the co-benefits and threat multipliers. 4, any geopolitics involved. 5, the science, of course. And of course, most importantly, the thing that never, ever changes, the inescapable, inexplicably indestructible humanity of us, who we are, why we are this way. And this is also, I cannot completely fumble when someone I respect asks the question, what comes next? But here's the thing. You might get nervous regarding how to respond as a human or voter, colleague, parent, teacher, whatever, when something big and unexpected happens. But where I get most nervous is when something big and expected happens and nobody's talking about what the plan is for the day after, for the aftermath. Recently, Bernie Sanders decided that one day in March should be Long COVID Awareness Day, which I think is great. So anyways, I thought it was an appropriate moment to try to pull together the threads of why long COVID pisses me off so much. Examples of other self-defeating issues we never learned from over the past couple centuries, and a blueprint that's not original at all for how to do better. But that's the point. Because it's not only Long COVID Awareness Day, I guess, it's also that, not unlike climate change, we're standing on the precipice of a bunch of different shit. Mostly knowing full well what we need to do to not fall down one side or the other, but just not doing so much of those things. Of course, the point is of today, we have been here before, up Schitt's Creek, sometimes having actively chosen this as our spring break destination, either way, without a paddle. Let's take a lateral trip to 2003, which has nothing to do with COVID. In January of 2003, Space Shuttle Columbia launched for the last time, and then Willis McGahee's knee dissolved on live TV, like Columbia eventually did. And the point is, America's shock and awe plan to, quote, completely dismantle Iraqi leadership was revealed to an extremely misled public. But the intention for shock and awe actually went much, much further. So from the same ancient CBS News article, quote, we want them to quit. We want them not to fight, said Harlan Ullman, one of the authors of the shock and awe concept, which relies on large numbers of precision-guided weapons. He said, so that you have this simultaneous effect, rather like the nuclear weapons at Hiroshima, not taking days or weeks, but in minutes, said Ullman. You're sitting in Baghdad, and all of a sudden you're the general, and 30 of your division headquarters have been wiped out. But you also take the city down. By that, I mean you get rid of their power and their water. In 2, 3, 4, 5 days, they are physically, emotionally, and psychologically exhausted. If that doesn't sound familiar to you, you haven't been really paying attention. Anyways, in March 2003, 2 months later, despite historic protests around the world, coalition bombing began. And on the one hand, on day one, we immediately got the result we were looking for: utter destruction. On the other, the plan failed on every level, and that is only partly due to the fact basically no legitimate plan for day two, for rebuilding the country. Literally, societally, politically, whatever. And do not write in about the CPA. It's fucking bullshit. Anyways, now we're in late COVID, at least as far as we've known it so far, so that's what I'm calling it. But we were once in late polio and malaria. Lyme disease can't stop, won't stop. Despite America's biomedical know-how, tens of millions around the world have died from COVID, and many more have come now some version of what we're calling for now long COVID. Concurrently, though, there's been a global drop in childhood vaccinations of all kinds. And so, fun stuff. Our ancestors worked really hard to beat back pretty recently. Like, again, measles are roaring back all at the same time. And look, let's pause. Is it immeasurably easier for me to armchair assist these failures of foresight from the safety of my blog or my microphone here, armed with snacks just off camera, and most importantly, decades and even hundreds of years of hindsight? Of course it is. And that's the entire fucking point. Even a moron like me can tell that we keep doing the same shit and not learning the lessons. Point is, post-viral, long COVID, post-viral symptoms, this is nothing new. Neither, for that case, are the after effects of bacterial infections like tuberculosis. Think of MS, and malaria, and polio, and measles, Lyme, again, HIV. You've named it, we've been there. Fucking ticks, man, you know? Even after successful treatment for TB, you can get stuck with pretty gnarly lung damage. Polio, lifelong muscle weakness, fatigue, atrophy. HIV, well, post-ART, it's thankfully a very different world for about 30 million people. But not everyone can get ART, so all the lucky ones get to take ART for the rest of their lives. For the rest, there's the possibility of AIDS. That's fun. And measles, the thing that's currently all over Florida. Well, after measles is blindness, encephalitis, and if you're extremely unlucky, SSPE, which will kill you instead of the measles. For whatever reason, we, the people, are really anxious to move on from whatever our most recent fuck-up was. So, for at least some folks, but probably not one of you, those incalculable 100,000 COVID death headlines from the New York Times feels like a very long time ago. But for folks living with long COVID, or who love someone living with it, not so much. However insanely obvious, it's always essential to remind you that the best way to not get long COVID is to not get COVID, or measles, or whatever, for the first time or the third. Our very magical vaccines and boosters do not prevent infection. But whereas the effectiveness of the original booster against severe COVID-19 was about 25%, the effectiveness of updated bivalent boosters was 62%, an increase of 37 percentage points. And again, there are a million ways to lessen your odds of exposure, even if, again, all of us have probably been exposed 30 times over by now, whether you've actually been infected and had some version of it or not. But opening our aperture a bit, and again, I don't know how cameras work, it's not just, for example, older Americans failing to get these great new COVID boosters, or ignorant millennial parents declining MMR shots for their small children. However simple and amazing treated bed nets are to prevent malaria infections, and however much we are committed to them, the insanely dangerous and self-defeating decline in global childhood vaccinations of every flavor complicates the whole landscape. We're just asking for more post-viral or post-bacterial issues. This ignorant bullshit, one, kills and maims kids straight up, and two, it actually makes actual outbreaks much more likely. We cannot simply ignore long COVID and those who suffer from it, or the kids who are basically forced to get measles. We cannot hope for a more rapid and thoughtful public health response next time. We have to constantly reduce the odds of there being a next time while dealing with the after effects of this time, of the last time. It appears at the surface level that at the very least we can frame long COVID similar to how we consider cancer now, in the way blood cancer is very different from tumor or basal cell carcinoma. From post-acute symptoms to long-term health effects, long COVID is a bitch. COVID has left this indelible, shitty mark on humanity, like the 1918 flu and HIV/AIDS and so many other viruses before it. But we've also learned some hard and necessary lessons since I wrote, quote, COVID was a pop quiz on all of the societal choices we made in the few hundred years prior to December 2019. The societal systems COVID and long COVID are testing are just as obvious and complex as the bodily ones. Exhaustion, brain fog, sleep issues, organ issues, neck pain, kidney pain, hearing loss, heartburn, hair loss, and of course, America's favorite, like 3 different types of heart disease. All of which means this is a social challenge as much as a medical one. We have a very long history of gaslighting, if not entirely dismissing, people, and especially women and people of color, with really any form of pre-existing condition. The growing totality and variety of long COVID means enough of that shit. It's high time for a step change in how we plan for and support people with post-viral issues. And again, not just medically. Trust in science is in the shitter, and tidal waves of disinformation are finding us with very little community backbone remaining to stem the flood. So we need a fucking plan born on the lessons we've learned over the past couple hundred years, and we're learning actively now. The plan is there. It's right in front of us. We have to help ourselves and people with long COVID now. Again, so none of these are new ideas. All lessons we've learned time and time again from other diseases I'm not going to say the words about again. And as always, I do look to one of my heroes, the late Paul Farmer from Partners in Health, for some inspiration here. Number 1, humble ourselves. We're really damn proud of how far we've come, but if it isn't clear, our recent and past public health achievements are fragile as hell. But we treat them, often literally, like we have made ourselves indestructible, as bacteria that doesn't give a shit about your antibiotics grows more prevalent every day. Long COVID is probably, honestly, like 13 different issues, manifested from some unholy combination of the severity of your case, your immune system, and any other pre-existing conditions. For most people across the US and the world, being poor isn't a choice. But unfortunately, even if you do have care, we are almost entirely focused on treating you and then sending you surprise bills later, instead of doing the social shit that will keep you and your family and your coworkers from getting sick in the first place. And of course, if you're in one of our many, many, many prisons, working an in-person hourly job with no paid sick leave or parental leave, or driving your family bankrupt at an understaffed nursing home, well, good luck. Good news, again, these are choices we're making. We don't have to be this dumb. Number 2, listen to patients. This isn't complicated, nor is it a new idea, but we are really bad at this, despite and because of cramming more and more appointments into a single day. Not everything is post-viral, but as recognition and prevalence for conditions like ME/CFS grows, we could try actually validating people's day-to-day health impacts. But we also have to listen to their collective voices to understand their advocacy and education efforts, however heterogeneous their backgrounds may be, and long COVID does not discriminate. At this point, not unlike ACT UP or other HIV/AIDS activists of the past, there is no one more experienced with, at least their version of, long COVID than the patients themselves. Number 3, recruit, train, and employ about a gazillion new community health workers to improve day-to-day wellness, distribute vaccines, support early identification of viral and bacterial outbreaks, provide ongoing care, and especially with all of our fucking paperwork and phone trees, navigation of the healthcare system as we know it. And educating parents and school boards is a big, 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 big part of this lever. Take a page or book from somewhere like the Mayo Clinic, which is great but imperfect, and Partner in Health, which is amazing but limited, from their community health efforts in Haiti and elsewhere to make care a community effort, integrating physical and neurological, nutrition, mental health, among others, maybe even housing if we want to get crazy about it. because the incentivized, for-profit specialization of American healthcare is literally killing us, and you only have to read about PIH efforts and successes or go to the Mayo Clinic once to understand how it could be, how it should be. Number 4, I think, actually consider social determinants of health, which are real things, just like we talked about with housing. Look at the health outcomes of the 40 states that have adopted that sweet Medicaid cash and the 10 that have not. Look at how much healthier families were before we started kicking millions of them off Medicaid this year. Access to care, socioeconomic status, housing, education are just as important as how infected you are, as how dirty your air and your water are. Number 5, sure. Fighting disinformation truly feels like a lost cause increasingly every day here. But with elections happening around the world basically every week for the rest of this year, and AI growing more accessible every day, we've barely seen the tip here. So credible, empathetic, consistent communication from trusted health workers and community members is really essential. The next one, 6, turn down the privacy ethics on your water. That was a joke. The point is, we need way more wastewater monitoring and analyzing, and also local and state and regional plans for what to do when, say, measles, or even something like norovirus shows up in your water. Number 7, maybe we should not let journalism die after all. There's so many reporters I worship, basically, if not just rely on. But how many Ed Yongs have to basically bleed into the page for 3 years and then semi-retire and completely burnt out for us to understand how vitally important, empathetic, informed, patient-centered journalism is. Number 8 or something, fund basic science and as many different kinds of meaningful trials as we can. Inside the box, outside the box, interdisciplinary, brain to gut, reverse, whatever. Test mitochondria for long COVID. Test to try and understand why and how the hell infectious agents like viruses and bacteria cause so many chronic issues, period. Randomize it, test it, peer review it. Don't charge $1 billion to submit or access it. Thank you. Next. On the other hand, stop wasting so much time and money. The NIH's Recover's trial, that lambasted observational study, makes the F-35 plane look cost-efficient in comparison. That's wrong, obviously, but the point is, it's not going great. There are 2 actual live in-person trials for Paxlovid and virtual therapy are going poorly. And we can do significantly better here. And of course, lastly, I think, do other basic shit. Forget the specific virus for 10 seconds, or all the other ones we mentioned. And just imagine us leveling the entire playing field against droplets of whatever size and flavor by improving indoor air everywhere. Making these vaccines wasn't simple, but now that we have them, we can vaccinate the world finally. Again, and it won't prevent against infection, but it will sure as shit save lives and tens of millions from their own long COVID journey, which doesn't have to start. We can't simply develop amazing new vaccines for malaria and even Ebola Sudan. We have to do the work to get them out there. By choosing not to do these things, we are not only failing to adapt to what COVID continues to do to us, but to leave ourselves even more vulnerable to future pandemics and the day after, the aftermath, which are both inevitable and truly something I'm fucking disinterested in. It's only been 15 years since we fought like hell over whether or not to cover pre-existing conditions in insurance. I always imagined back then that the only way you could possibly vote against that coverage was if you simply didn't love someone with a pre-existing condition. In 2024 and beyond, as so many long COVID journeys will start and other journeys that we talked about, that scenario of not knowing or not loving someone with a pre-existing condition, it's becoming extremely unlikely. So as we struggle through the aftermath, after everyone's favorite Supreme Court made that state Medicaid participation voluntary, 10 mostly red states still refuse to take that Medicaid money, leaving about 2 million of their citizens out to dry. But on the other hand, 40 states have adopted it. 40! Even if, and yes, I will keep calling this out, we let millions of people get and have Medicaid during COVID and then kick them back off, mostly because they couldn't figure out the paperwork. The point is, 40 states out of the 50 plus DC and Puerto Rico, which should be states. Anyways, extend the idea of the aftermath and uncover more lateral examples in your own work, in the unholy aftermath of our ultra high processed food system, of deforestation, air quality, water quality. Again, wiping the Medicaid rolls. I will not let go of this. Of not overhauling indoor air in schools and offices. Where, for example, PEPFAR tilted the course of history, helping to carve out a real 21st century for millions more actually healthy young people across Africa. A four-quart press or kitchen sink or whatever effort to pay the long-term cost of COVID would similarly adjust history. We have to listen to patients. We have to help people not have to become patients. Pro-life means here and now. Whatever you think comes after this life, if anything. Even if we are simply borrowing the earth from our children. As we should each seek to be, as one of my guests puts it, better ancestors. For millions of people across the world, this virus and others lurk in various parts of the body long after they're infected, newly disabling them in a variety of ways. We don't have to let that happen. But otherwise, that shrapnel will be what remains with them and with us as a society as we deal with this on a social level on a day-to-day basis in the years to come. And look, these vaccines are amazing, and all the different exposures we've all gotten are what they are. And it means that the odds of getting severe COVID are far lower than they once were, thanks to all of that. But COVID is not going anywhere, which means long COVID isn't either. But that doesn't mean long COVID has to start, and that doesn't mean we get to ignore the people that have it. Policymakers here and abroad have the opportunity to, barely start to make up for not vaccinating the world 2 years ago by doing it now, while simultaneously turning over every possible rock to at least relieve some of the long hauler symptoms for some of the many, many people who already have or will get them. It's the aftermath. We cannot ignore it. The aftermath of learning and committing to washing our hands, to not smoking, to bed nets, again, to eliminating acid rain, closing the ozone hole, to the HPV vaccine, to not shitting in our drinking water. These have unlocked glorious futures. They were revolutions into themselves. You and I are not Biff Tannen, so we cannot see what the near or the far futures will bring. But we can see what's in front of us. We can actually learn from what came before us and who came before us and how they suffered. And we can adapt our culture and our society and our care for a world where COVID and those suffering from its after effects may be with us forever. That's it for this week. If you've got feedback, questions, opinions, I'd love to hear them. Email them to me at questions@importantnotimportant.com. And of course, hit subscribe wherever you are, or 5 stars or both. You'll get next week's issue straight to your feed. You can see all the old ones and you'll help us out. To go deeper, visit importantnotimportant.com. Thank you for listening, and thanks for giving a shit.